I'm Dan. Thank you for watching. So today is a really short video just to talk about the process of getting diagnosed or re-diagnosed in the UK and under the NHS. So across the country at the minute we've got problems with services diagnosing people and huge waiting lists, and some people, if you were diagnosed as a child like I was, then you can't be diagnosed again, depending on the provision that's in your area, which is bizarre. So others are waiting years on lists and not being seen. So I decided to contact a private diagnostic service called Psychiatry-UK. I have done a video previously about the service and how I found it and what happened, but the video was recorded in my garage with barely any light, which is the same now to be fair, but I'm in the conservatory. There is light in the daytime, so it's a bit better. I think the other video I chucked up a green screen and it looks a bit awful. But I wanted to kind of go over that anyway and talk about the whole process. And it has changed. So when I first found out about Psychiatry UK, I completed a form on their website and they contacted my GP on my behalf. That's now changed slightly. I think you need to approach your GP and ask them to contact Psychiatry UK, who will then contact the CCG, which is the commissioning group for your local area. And if there is no service locally that can see you, then you should be able to, well, you have got the right to have service elsewhere, must be treated elsewhere. Any issues with that they can probably help you out with, but that is your right under the NHS constitution. I'm not going to go into that because I don't know a great deal, but that's there. So if you're struggling to get your diagnosis, that option's available. If the GP doesn't agree that you could have ADHD, then you should ask to speak to another GP or just see the GP again, try to get an understanding why, because they're not qualified to say you haven't got that. They can't diagnose it, but they can't also turn you away. So speak to your GP. If there's a really good reason why, then speak to them again and see if they can. Otherwise, speak to another GP or speak to the practice manager. Other than that, probably get some advice. But if the GP won't support you, but he agrees that you could be diagnosed with ADHD and refers you to another service but won't support your application to go to Psychiatry UK, then again, speak to the practice manager or speak to your clinical commissioning group directly for advice, because you do have the right to choose. So that's the first part. Once that's sorted and you're under the service and the CCG have agreed to fund you, it's usually quite quick. It was for me. It was probably a week or two later I had confirmation. From then I spoke to a doctor. He introduced himself. I had some forms to fill in about my history and what's happening now, what happened in my childhood. And I had another form for someone close to me to fill in, which I gave to my partner because I've lived with her for probably 13 years now. So we did that. I spoke to the doctor, had a virtual meeting, which was probably around 45 minutes to an hour. And I was nervous at first. I've seen people say to me that they're quite anxious and they're worried about it and they're not sure what's going to happen. But as soon as I spoke to that doctor, he was really friendly. He listened to me. He let me speak. He had read everything that I sent over and he agreed early on that I still have ADHD. So he diagnosed me with ADHD, or re-diagnosed. But either way, for me, that was a relief straight off the bat. No matter what happened from there, I was happy. And I think just being listened to and not being wrong was good. It feels like a weight off your shoulders. And obviously just with that diagnosis, you have got rights then. You've got rights in the workplace, you've got rights to certain things and help you need. And there's all sorts of things you can get. But just clarity and confirmation was really what was good for me. So from there, the doctor put me in touch with a nurse practitioner who contacted me a week or so later to start the titration process. So begin medication and see how we got on. I started off on methylphenidate, which is Ritalin, or known as other brands. It's Concerta in the US, and some parts of the UK have Concerta or Concerta XL. It's Medicanet, Equisim, I think is one of the names that's available, but Ritalin and Medicanet and Concerta are the ones I've heard of. But it's the same kind of drug anyway. Ritalin LA and Medicanet XL are the extended release. It could be different where you are, or depending on what your pharmacy supplies, but it's the same drug anyway, methylphenidate. So I started on that, built up from a slow dose, put me in a low dose and built it up slowly over, I think, a 4-week period, and then fed back to the nurse each week. And at the end of that month, we chatted over the phone and discussed what was working, what had changed, and how I felt with the medication. And to me, it wasn't amazing. I've seen some good effects, but it didn't really do what I'd expected. We moved on to another drug, lisdexamfetamine, and again, did the same thing, but for me that made things worse. I probably noticed then that the first drug had some good effects that I probably hadn't noticed at first, because it didn't kind of like switch that some people get. But also, I think I was expecting a lot more from the medication than I eventually had. So once we'd done that, we went straight back to Medicanet, so the Ritalin or methylphenidate, but the prolonged release, which I'm on now. Once that was done, Psychiatry-UK contacted my GP for prescribing, which was fine. So then I'm not going out buying private prescriptions, which, by the way, if you're on the NHS and your CCG are funding the treatment and you have to pay for a private prescription, you will get the money back. So just don't be alarmed if you get a pink prescription slip come through and your pharmacy wants £200-300 for a prescription. You can claim that money back. And if you can't pay for it, contact Psychiatry-UK, because they can help with that as well. Whether it's calling up the pharmacy and paying for it, or just agreeing that they'll pay it back. But I did that once, and then after a couple of times I had to pay for it on my card, just to get it and then claim the money back. But it was pretty quick. A day or two later I had the money back, and it was fine. So also in the UK, if you get to do that and you have to pay for your prescription, even temporarily, some of the supermarket pharmacies, I think Asda is one of the better ones, they're apparently a lot cheaper than your local pharmacy could be. So instead of paying £300, I think someone paid nearly half of that amount by going to the supermarket pharmacy. But I didn't do that because of COVID, and I'm not close to a supermarket. But the option's there. So from there, I've had the medication now for probably, it's got to be 9 months now I've been on this medication. I can see a difference. I can see when I start something, I can actually finish it. Some things are less overwhelming, but I do know that it's not the be-all and end-all. It does help, but it's not a cure and it's not amazing. It's just, it helps. So if you're looking for medication to just fix everything and be a quick cure, that doesn't happen, unfortunately. But it can help. And if you take your medication and remember to take it, which is a big thing, and remember to actually get it in before you run out, another big thing, then with your own strategies in place and with CBT, it can be quite useful. So for me, the whole process of going through Psychiatry-UK has been amazing from day one, really. When I first started and contacted the GP, it was that quick. Everything went through, and it was like, well, if I'd have known about that, if the service was available probably a year or two before that, I wouldn't have had to run around speaking to a doctor, getting rejected for referrals because I'd already been diagnosed previously in childhood, and I was just left in limbo. That wouldn't have had to happen, but I'm glad I've been through it so I can see how other people cope across the country and what's happening, and trying to play my part in that, in what I do in the council, try to highlight the fact that there's a lot of people still struggling to get help. But also, if you're not aware of these services and you come across this video, then look into it. Look into Psychiatry-UK, speak to your doctor, speak to your CCG, and look up the right to choose, which is the NHS right to choose, and also the time to treatment, which is on the NHS UK constitution. So from referral to treatment, there's a time there as well for various things, and it does change slightly, I think, for certain conditions. But look up also the NHS NICE or NICE guidelines on ADHD, and you'll see the medication that I'm talking about and what they should follow. which is, the process of giving these drugs as long as you can take stimulants and you haven't got a history or anything that will stop you taking stimulants. And you can read through that. And even if you're not going to Psychiatry-UK and you're going elsewhere, you can see the process that medical professionals in this country should be following and the medications they're talking about and what should happen if it doesn't work. The only thing I would say, if you get to the point where you've taken all these stimulants, and even if you've moved on to a non-stimulant like atomoxetine, if you're not getting a massive benefit from any of these drugs, they can apparently combine some of the drugs, use a mixture of both. But if you get to a certain point, 3-4 months down the line, you're not seeing any benefit at all, and you say it's not good for you, it's not working, then your GP won't be very keen to do shared care just yet, or shared prescribing, because the benefits aren't there. So you do need to kind of look for the benefits. I don't mean lie about them, but don't make it out to be all bad if there is some benefits. Be open, be honest, and tell them what is working and what doesn't work. But if they don't see a great improvement for these medication, there is only so many different medications you can try. So I found that at one point I was hoping to find something much better and it doesn't come along. But by using CBT, by getting your own help and putting strategies in place and learning as well your environment and what things make you worse and what can help you, putting all these things into place along with your medication will have a massive effect on you, and hopefully it'll be really good. So yeah, if you found this useful, I've probably waffled on a bit. I haven't got any kind of script that I normally have. I haven't been doing anything for my business, and it's quite late at night as well because it's quiet, so I have to wait all day to do the video. But if it's helpful anyway, let me know. Also, if you're still watching, thank you for watching and staying to the end. I would love you to join me online in May 2021 at an event called ADHD Unlimited. And briefly mention that I was on the show with Dr. Dawn Brown, a friend, and she's an ADHD expert and also has ADHD herself. She runs the ADHD Wellness Centre in America and just all sorts of other things as well. She's been on TV, she works with NFL, all sorts of athletes, to be fair. And we had a chat. I went on a show. We were talking afterwards, and I was talking about one of the things that I've been planning for a while, but hadn't quite come around to doing yet and putting into action. And just by speaking to her, we said it was a great idea. I came up with a name for it. I put things into place and organised it, which I'm in the process of doing now. So that's ADHD Unlimited. It's going to be a live event for adults with ADHD. Obviously, my focus, some of the things I want to be doing there is around business and entrepreneurs and letting people know that they can run a business and how they can do different things and how they can take their idea they've had in their head for a while and actually turn it into a business. But the whole event, I'm hoping, will have something for absolutely everyone. Young adults, people who are being diagnosed late in life, and just all sorts of people. We've got some really great speakers involved that have agreed. Some have signed up already, some have said they'll happily do that. And I'm working on a list of really, really good speakers that I'm going to reach out to and pray that someone joins in or some of them join in. But even now, the lineup of people that have agreed is perfect. That's called ADHD Unlimited, and I'll drop a link to that in the notes below. If you're interested, you can come along for free, you can watch it. You can grab an all-access pass for $39 at the minute before the price goes up. And if you want to speak or you've got any recommendations for a really good speaker, someone you'd love to see there, or a topic you'd like to hear about, let me know. I really want to make it so there's something for everyone. So yeah, feel free to speak, feel free to contact me and let me know your thoughts. Take care and thanks again for watching.